We're back now on CT21 with Governor Ned Lamont. And Governor, some news broke this past week about Yukon. President Tom Katzalea is saying that he will be resigning, stepping down at the end of his contract in June. I just want to ask you for your reaction to that news when you got it and what it means for Yukon moving forward.
Tom Katzalea is a good friend of mine. He served ably, from my point of view, as president of Yukon. He's going to step back and be Professor Katzalea. I think you have to be able to work very closely with the board of directors. That's what they've got there at the at Yukon, and they thought mutually that it was probably time to make a change.
All right. Back to the coronavirus. We saw that the Emergency Powers Act has been extended yet again by the to move forward for a longer period of time for you to be able to deal with this using executive orders like we talked about at the top of the show. Why is that necessary?
Strictly related to public health and vaccinations. As you know, we're just launching now, 12 to 15. That means we've got to move pretty fast to be able to get those kids vaccinated. There could be a younger age group later on this summer. There could be booster shots later on this summer, depending on what the variants are. So I'm thankful to the legislature for stepping up and saying, strictly within these public health parameters, we're going to give the executive a little more authority and leeway so we can move quickly in the name of public health.
I think some of the criticism that you've received over this whole time has been the fact that it was a lot of things coming from the executive office by way of orders. And some of the criticism here is the legislature's back in session, which we couldn't say last March, April, May. Now they're in session. We saw as far back as September 2020, I saw Lee Elsey in The Day, a columnist there, referring to you as King Ned. I know you've heard that before. There was protests about that. Do you worry about that characterization, and why not just let the legislature weigh in when you need something, even on those categories?
They are welcome to weigh in. They've been in session since January 6th. If they think I'm reopening too quickly, they can pass a rule, pass a law. I'll follow their lead. But I think basically keeping it narrow to public health, I really appreciate them giving me a little more discretion, a little bit longer.
All right, let's talk about evictions, Governor. That's one thing a lot of people are worried about, is this eviction moratorium. Where does that stand in our state, and what's your plan for that moving forward?
Right now, it's supposed to end on May 20th. I think I'm going to recommend to go for another month. It cannot go on forever. You say, why another month? Because right now, Department of Housing, we've got $48 million from the feds to do rent relief. But that's not simply a matter of sending out a grant to people. That's not the right message. It's having tenant and landlord together come up with a plan so that they can stay in their homes and the tenants have the resources they need. That takes a little longer than we thought. Hopefully we can get it done in a month or so.
That's one of the things we've heard. We've had some people calling us here at Channel 3 saying that they tried to take advantage of that and they just can't get through the red tape. Does the program, I mean, it sounds like with $48 million, there's a lot to go around, but not a lot's been handed out yet, I know. Is it just a logistical issue? Where does that stand? What has to happen there?
DOH, Department of Housing, is ramping up. It's easy to hand out grants. Here's $5,000. Please go pay your rent. That's the way they often do it in Washington. But we're trying to have something a little more of a partnership between tenant and landlord, so people are actually paying their bills over a period of time, helping them get back on their feet and stay in their home or business.
Whenever it ends, whether it's a month from now or if you decide to extend it again, do you worry that whatever happens, there will still be a flood of evictions? There will be people who, for whatever reason, the program missed or weren't eligible. Is that something that you're bracing for? Because that, if it happens, could be ugly.
That would be really unfortunate. We got $48 million. That seems to me like an awful lot of money where you can settle a lot of these disputes early on. The other reason you can't settle these disputes in the courts because the courts are just now opening up, Eric. So that's reason number 3. I think it's worth waiting another month.
Does the CDC order and the exceptions there, the moratorium through the CDC being struck down by a judge, does that have a big impact in your decision making?
No, not really. I mean, my decision making was really based upon our being able to make a deal between tenant and landlord, and the courts not really being open at full throttle yet. We needed a little more time.
Moving on to some other COVID-related topics, Governor, one thing that we saw the legislature do was extend this outdoor dining, this exemption for restaurants to be able to continue to have outdoor dining and not have to go to their town zoning board. And so that's one of the things that the Restaurant Association, for instance, says that should just be permanent. This is something we found out that worked. Is that something you would consider having that be a longer term solution?
Absolutely. I thought it was great. I thought it brought a lot of our sleepy towns and cities to life. I loved closing the traffic. I liked seeing everybody outside. If you've been vaccinated, you can get a free drink at one of our restaurants. We'll have free Wi-Fi out there. I really hope it's something the legislature makes permanent.
Are there other things that have come across your desk that maybe changed because of the pandemic that you're saying, maybe this is something we ought to continue doing?
We're going through that with the legislature right now. We just did telehealth, for example, and said we extended that for 2 years. I hope we extend that forever, where you don't necessarily have to drive and go to the doctors. You can do it electronically, remotely, virtually. And I think for 90% of those visits, that's just as good and just as effective and a lot easier.
How about absentee ballots? We saw the vote in the legislature not get to the required percentage, so we'll have to come back up again for a vote. Were you disappointed that that constitutional amendment didn't make it?
I am. I think we showed during the last election that we can vote absentee. We can do it safely. We can do it with integrity. I think people voted with their feet in the sense that they all use the absentee ballot. I think it's something we should make permanent. And I wish we got to 75%, because when you don't get to that in the legislature, it takes forever. But we'll get it done.
How about moving forward? Obviously, one of the big concerns here is that now we're starting to see the demand for vaccines drop below the available supply. Is there efforts ongoing right now to keep getting people who haven't been vaccinated to a clinic?
Oh, absolutely. I mean, I'm working. The younger people are getting vaccinated, 15, 16, 17. Maybe they have a little pressure from the parents. It's the 20-somethings, the invincibles that are the probably the ones that need a little more of a push to get vaccinated. That was part of our Drinks on Us. That was part of free tickets to the Yard Goats game. Those are part of the incentives we're trying to do to get young people vaccinated.
Just one last question. We're almost out of time, Governor. I want to ask you this. If people are watching on this Sunday morning, what's the milestone they should be looking for moving forward? Is there something that, is it that June 20th date? What should they be watching for as a piece of good news, maybe to focus on in the days ahead?
I think the good news is now. I think our infection rate is really at the lowest it's been in 7 to 8 months. I think that's going to continue. I want to see our vaccination rate go up. I want everybody vaccinated. Let's get to herd immunity sooner rather than later. And that means we can have a really great summer and I think a really good fall. I think we're turning the corner in the state. Thanks to each and every one of you. You've been cautious.
All right, Governor Ned Lamont, thank you for joining us once again here on CT21. We'll be talking to you again, I'm sure.
Take care, Eric. Thanks.